Aging is a very natural process. Every organism, be it a plant or an animal or human being, everything undergoes this aging process. Now what exactly is this aging? Every cell of our body, right from the time it is formed, there is a definite lifespan for it, and after that it gets destroyed. So this cell is replaced by another cell of the same kind which carries on the same function. Now when this destruction of the cell and regeneration of a new cell takes place in the same pace, then definitely there is no disturbance in the function. But over a period of time, what happens is the regeneration rate does not match with the destruction rate. It is slower. So as a result of it, there is reduction in functional efficacy. In every system of the body, the physiological functioning deteriorates, and this is what we generally understand by the term aging. According to Ayurveda, Vardhakya, that is old age, is predominant in Vata dosha, that is the factor that is responsible for increase in roughness and dryness of our body, and there is also the binding factor gets reduced. So as a result, there is increased in looseness and flaccidity. So not only in the skin, it also occurs in the entire body. In the skin, it is visible in the form of wrinkles and dryness. Even there is sagging of skin, and also there is reduction in luster. So generally people do say that when they age, I have seen many people telling that my color has reduced, it has become more darkened, my skin has become more darkened. So these are the general complaints that people say regarding skin. In the hair also we do find such kind of changes, that there is reduction in the density of hair, and hair becomes rough, hair fall increases, the luster of hair also goes off, and eventual graying. So these are some of the changes that we do find. Now in the muscle also, if you see, there is reduction in tone. So as a result, the general day-to-day activities also, this particular reduction in tone affects. So the kind of work they used to do in their youth, though that kind of work they are not able to do because the muscles are not very supportive. In digestive system, if you see, actually the digestive system starts from the mouth. So there is looseness of gums, and the teeth is shaking. So as a result, elderly people, they find it difficult in chewing things, especially hard items, they find it difficult in chewing. Now as the food comes in through the esophagus and enters the stomach, actually there is a sphincter in between the esophagus and stomach. So this particular sphincter, the tone of it reduces. So what happens is, often we come across of complaints of acidity, heartburn, all these things, we term it as gastroesophageal reflux disorder. That is, the gastric juices from the stomach comes up to the esophagus because the sphincter tone has reduced, and this is a very common problem that we come across in elderly people. Similarly, quantity of food what they consume also reduces. Often we do find that elderly people, they say, I am not able to consume the same quantity of food that I used to consume in my youth. This most of you must have noticed. So the quantity of course reduces, and there is increase in time of digestion. Suppose they have food in the morning, by afternoon, as in their youth, they don't feel hungry. Of course, when there is increased time of digestion, when the food stays for too much time in the body, the problems of gas bloating also is very common. Then elimination is also very slow. Most of the people do have problems of constipation, that is dry hard stools, especially because the bowel motility, that is a tone of the muscles, has weakened. So bowel motility is reduced, whereas in some people it might be the other way around. When they have the urge of passing stools, they are not able to control it. So there again, these are the problems regarding muscle tone. Then apart from this, even the secretions reduce. Secretions can be anything, can be the mucus secretion, that is the inner linings of our gastric system is being lined by the mucus layer which secretes certain fluids. So when that reduces, similarly when the enzymatic secretions reduces, similarly the hormonal secretions reduces, all these collectively have an impact in reduced digestion system. Even in the cellular level as well, there is reduction in digestion, and hence there is sluggish metabolism. And very common problem is diabetes mellitus that we find in elderly people. Also there is reduction in secretion in many other systems. Generally there is reduction in fertility. In women after menopause, they do have postmenopausal problems like intensive body heat. Suddenly it occurs, followed by intensive sweating. We generally term it as hot flushes of menopause. And similarly postmenopausal emotional imbalances, when they laugh or when they even cough or sneeze, there is little bit of urination. Medically it is termed as stress incontinence. So this is yet another problem that we find in old age. In men actually there is increase in frequency of urination, and prostate related problems occur. Also in the cardiovascular system, the blood vessels actually they lose their normal elasticity that was there in their youth. So as a result the blood pumping gets affected. Most of the common problem is blood pressure in elderly people. Similarly there are deposits in the arteries leading to atherosclerosis kind of problems, and eventually leading to heart attacks, strokes like problems, reduced cardiac efficacy. There is also reduction in bone density. The bones become weaker, they become easily fractured. It's the synovial fluid that is present in between each joint. It gets reduced, and eventually there is rubbing of bones against each other, leading to wear and tear. So this over a period of time keeps worsening, and hence osteoarthritis kind of problems are most common. Problems like fibromyalgia, that is unspecified muscle aches and pains. Insomnia is a very common problem that we come across. Memory issues, the cells in the brain undergoes atrophy, that is degeneration, leading to memory issues. It can be either just a normal dementia or some other diseases like Alzheimer's disease. All these can be associated. Tremors are common. It can be either due to generalized weakness or any of the diseases like Parkinsonism, which again is a old age disease. Loss of sensation in fingertips, in the feet, pins and needles, all these things they do complain. Similarly also balance, loss of balance is also one of the very common problem we come across. Dimness in vision, especially associated with cataract or glaucoma. Similarly even psychological disturbances, it can be either as depression or as anxiety. All these things are associated. So I have enlisted many of the problems that generally occur in elderly people. Now the irony is that all these problems which used to occur in 60s or 70s have started occurring in 40s or 50s. We do find a lot of cases of this kind.